Welcome, welcome. We're just giving folks a chance to join. We will start shortly. Good morning, everyone. We would love to hear from you. Maybe you can put your name in the chat and where you're joining us from. That would be great to meet you. We're just going to give folks another 2 minutes to join, and then we will start. All right, good morning. I think 50 is a great enough number to start with. Welcome, colleagues. If you're joining us for the first time, happy to have you here. If you're returning, thank you for always supporting and joining us in this learning adventure. I am Elizabeth Baini, Research Specialist at Ilifa Labantwana, and I'll be facilitating today's discussion. So this is the Early Childhood Systems Perspectives Research Webinar Series. It is a joint initiative of Ilifa Labantwana and our partners Research on Socioeconomic Policy, that's RESEP, at Stellenbosch University, and Data Drive 2030. The aim of this webinar series is to explore the latest perspectives and research on issues affecting the early childhood development service delivery ecosystem. And obviously, our passion is to create change for children through the promotion of data and research. So before we go into today's meaty discussion, just a couple of housekeeping. We would love for you to put all your questions in the Q&A box so that it helps us to easily navigate when the time comes. There'll be an opportunity after the presentation to ask your questions. We've got a really capable technical team who will help unmute you if you so wish to ask it yourself, or I can read it on your behalf. So you can put your questions in the Q&A answer box, or you can raise your hands during the Q&A session after the presentation. All right, so interestingly, we find ourselves in a very precarious position as a country. Women in South Africa spend 6 times as much time as men on unpaid care. This includes childcare, cooking, cleaning, taking care of the elderly, so mostly domestic reproductive work. An estimated 4 million of working age women are outside the paid labor force. So that is to suggest they're not working or they're unemployed. Many of these are because of their care responsibilities. So they might be able to work if they didn't have to take care of their home front. These disparities in unpaid work are profound drivers of gendered economic inequality. It restricts women's time and the opportunities for education and decent paid work. That is to say, we can't fix gender equality without fixing childcare. And today is precisely what we want to discuss and talk about and find ways of navigating how to fix both gender equality and childcare as a dual problem that have the same solution. So this morning, our topic is on caring for the caregivers, and we want to reimagine how early childhood development can be using the motherload lens. And today I've got the privilege of having to learn from and also sort of unpack this gendered care work and childcare and where they intersect with a really exciting presenter, Professor Amita Jaga. She is a professor of organizational psychology in the School of Management Studies and the Deputy Dean of Transformation in the Commerce Faculty at the University of Cape Town. She is a Southern and colonial feminist work family scholar. That's quite a mouthful. So we will understand once the presentation starts what that all entails. Her research explores intersectional inequalities in care work and the global imbalances in knowledge production. Her current projects focus on maternal challenges in employment, including advocating for workplace breastfeeding support and shaping care economies grounded in the lived experiences of low-income mothers. So she's currently the principal investigator of Sharing the Motherload, an IDRC-funded multi-stakeholder participatory action research project aimed at transforming care and employment opportunities. I don't think there is none other more qualified to help us unpack how and what it means to care for the caregivers. So over to you, Amita. Welcome and thank you for joining us and agreeing to share your research with us. Over to you.
Thank you so much, Liz, and thank you all for having me present at today's seminar. I'm going to share my slides. Is that good on your side, Liz? Okay, thanks. So I want to share with you today what has come to be termed the motherload. It was first a Freudian slip when I was telling somebody about the mental load of low-income mums and by mistake said the motherload. And then the project name stuck, or the name stuck became our project. And then the title of our pilot exhibition. And then it developed into an expanded concept. And I think now it's at the space of being an analytical lens. A lens that helps us to move beyond describing the burden of unpaid care work to rather to helping to interrogate how and why this burden firstly exists, how it's produced, how it's sustained and legitimized across different systems like the family, community, workplace, and the state. It's also a lens through which we see how gendered expectations, economic inequality, and inadequate public support shapes the lives of caregivers and accordingly their children. So in today's session, I am inviting us to reimagine what the ECD ecosystem might look like if we truly valued care and cared for the caregivers. I'm not an ECD expert. Rather, I'm sharing our team's journey on the Motherload project and some key insights that we have gained over the last 3 years that have helped us understand the complexity of low-income women's lives. So I'm going to take you through our journey very quickly as a timeline. In 2023, there was a UCT Grand Challenges call. Prior to that, my research had been on advancing breastfeeding in the workplace, and I kept noticing how well-intended state maternity protection policies missed the realities of low-income women's lives. And then in COVID, I noted the same parallels of the lockdown rules, how they were sort of designed for people who weren't really experiencing the constant struggles of what it meant to be living in low-income contexts with limited resources, with the desperate need of income and support. And so we started seeing the results of the NIDS CRAM study, where they were showing how of the majority of job losses, mostly women were hit by those. Also in terms of the high levels of women-headed households in the country, and in those households, increased percentages of hunger, and linked to that to depression. And I was particularly interested in the intersections of those vulnerabilities. The NIDS CRAM data pointed us to these problems, but it wasn't insufficient in understanding the sort of contextual nuance in the local context. And so wanted to use photo voice to foreground the women's voices that I'd seen were missing in policy development, and in when decisions were being made. And through the UCT Grand Challenges pilot, I was able to do this. It required us firstly to work across 3 academic faculties and with 2 non-academic stakeholders, which initially I thought was quite challenging, but it is really one of the strengths of our project. So I reached out to Fiona Ross in anthropology, and Tristan Gergens in the Western Cape government, who had been working with on the breastfeeding at work and research, and they reached out or brought other people in. So Tristan then linked us to Flourish as our women's community partner, and also to Jane Battersby, who worked in environmental and geographical sciences, who was working on a project on food systems. We also worked with Wanga Zembe at the South African Medical Research Council, and who brought in her sister Yanga as a decolonial methodologist to guide us through this process. Because I was by no means an expert. I had a little bit of understanding on decolonial methodologies and had done it at a very sort of beginner's level, I would say. We also then brought in a group of students and research assistants, and we worked across the year in a participatory action research way to work with, started off with 12 low-income mums, building trust. I think trust building was incredibly important to begin the process, and then gaining a deep understanding of their strengths, their struggles, and their needs, which they took photographs of, and then they told us stories about it. And the stories sort of unfolded into collective stories, which gave us understandings of the collective struggles that the mums were facing. They then developed these over the year into a curated exhibition that they co-curated, and also a set of calls to action. A key moment in the pilot was really when the mothers, in their own words, articulated the deeply patriarchal contribution to the motherload. In fact, in their words, they said, "We want to end the domination of men, and we want men in the room." They actually said, "We want the problem in the room," but by problem, they were referring to men. And at the time, there was a call by the IDRC in a program called Scaling Care Innovations in Africa that had was looking for projects that had a pilot or proof concept. And we thought one way to scale was to bring low-income fathers' voices in to gain a deep understanding of men's perspectives on care, and how to shift these very stubborn gender norms on unpaid care work. So to that together with scaling out also and bringing in stakeholders that were working with men in trying to shift narratives around men, but also our project was really not on fatherhood at this stage. It was on the motherload, and how could fathers play a role as allies in recognizing it and redistributing it and reducing unpaid care work. Yeah, so from there, we sort of really want to understand more deeply, now that we had a bit of insight into the lack of infrastructure and policies that weren't thinking about the mother and the child together, or what the mother needed to navigate in terms of multiple systems in one day, or in day-to-day care realities. So they were thinking about mums in very fragmented ways, as though it's not one mother navigating all these systems across sort of from pregnancy to when the child is much older. So we then got the scaling grant, and we were able to begin that in 2024 to deepen the understanding of the motherload with mothers, and then engage fathers on their understanding of care and the barriers of them engaging in care. And we worked separately with a group of mums, the same group of mums across the time, and then this group of dads, then finally bringing them together in August 2025. Through that time, we also launched our website. So at the end of the presentation, you'll see our QR code where there's a number of resources that you are welcome to download and utilize, and also launch a social media campaign, because we felt it was really important to not only speak to academic audiences, but to speak to civil society in really bringing attention to the complexity of unpaid care work, which we were calling the motherload, to show its causes and its consequences in a language that was simple enough for people to really understand. And then in September 2025, we launched our full exhibition of the Scaling Project, which is 144 photographs with captions taken by the mums and the dads in the project. That ran for a few weeks at the National Gallery Ezeco Annex, and is currently now, for the month of November, in the Western Cape Government Building in the concourse in the CBD of Cape Town. So if you are in Cape Town, please do go and have a look at it. It's incredibly powerful. It really centers the voices of low-income mums and dads on the struggles around care. So I'm not going to speak about the pilot and the pilot's findings in detail, other than to say on our website there's a beautiful 1-minute video that really shows the power of this decolonial methodology, of collaboration, of centering women's voices in policies making spaces and in programmatic improvements. And you are welcome to go have a look at that. I do want to raise a few key issues that were surfaced by our pilot. So entrenched gender ideologies frame care as natural, but we know it's social and not biological. Care is not only gendered, it is shaped by economic, cultural, and historical forces. So in the pilot, we gained a nuanced understanding of how the undervaluing of care is a legacy of both colonial and patriarchal systems. We saw this in how the photos led to conversations about the legacies of spatial planning, what this meant for mothers' commutes. They were tiring commutes and dangerous commutes, how basic infrastructure like sanitation was missing, which created mums having to spend more time and energy on basic hygiene, and how women's voices were not valued in communities when they tried to raise issues to improve systems, for example, like transport for very young children getting to school, like even as young as 2 years old, children are having to walk long distances in dangerous spaces. And when they spoke to the community chief, their response was that it's not an important enough issue to put energy and time toward. We also recognized how attention to labor mostly neglects social reproductive labor, which is largely invisible. Even though unpaid care work is work, it takes women's time, energy, and mental effort. We gained insight into mother stories of postpartum depression and the lack of recognition and resources for it, of the mental load that is very different to the conceptualization of it in northern frameworks, where it's spoken about, women's preoccupation about who's going to do the grocery shopping or who's going to fetch the kids from extramural activities, often in a nuclear family structure, and speaking about the division of gendered labor within the household. But in our context, we know that most mothers were singly heading up households, and our mothers were sharing stories on the mental preoccupation regarding survival, the constant planning, worrying, anticipation, for example, thinking about how to stretch a meal when there isn't enough food, having no nappies, having no one to go to ask for help, worrying about how to keep a child safe in gang-ridden neighborhoods, wondering if their child is safe at the creche because they can't afford a better one, and having seen a child maybe a few weeks before that walk out of a creche onto the street with nobody watching. The expanded public works program, those jobs pay less than the cost of transport plus childcare. So it pushes moms into debt traps if they want to take on these jobs for skills building and opportunities. Community leaders gatekeep these jobs also, so the only way in which a mom could be guaranteed one of these jobs is through sleeping with somebody. Their CVs are tossed away until they actually have to give up something of themselves to get attention, to get the jobs. Some services are there, but they're not integrated and designed from the perspective of a low-income mum. So, for example, a weekly mobile clinic in one informal settlement is on the opposite side of a forest that is dangerous for a mom to walk through on her own with a child. So a mother then has to find somebody to accompany her, pay them, and then when she gets to the clinic for the child's vaccination, they're told they're out of stock and they must come back the following week, or they must travel to another facility, which again costs them. A mother took a child to the hospital and was attended to only later at night and then discharged at 3 a.m. in the morning when there's no public transport and it's unsafe for women at that hour of the day. The health system books a mother and a child on the same day for their respective appointments. But then when the mother needs to go for her contraceptive injection, she's told that the child cannot come into the room. So then who looks after the child? And one last one. A mother books a mental health appointment. When she gets there, they are short-staffed and told to come back again. Of course, she doesn't come back again because she really doesn't have the time and had already wasted a day. And by not returning, the statistics show low clinic usage, signaling that the service isn't needed. So these service failures also keep women out of paid work, like Liz said, and there are multiple costs. There are costs to mum's time, their energy, and it costs them in monetary terms. This, together with infrastructure failures and political neglect for the carer, really gives us insight into the full complexity of care and what a care economy needs to address. Even care taking place in liminal spaces that is often not counted even as unpaid care work. So liminal spaces of queuing in healthcare facilities, in commuting from one service to the next because you sent from one place to another. So this then gave us a really good understanding of how to think through the concept of the motherload. Our formal definition is that it describes the highly gendered, often invisible, undervalued work that individuals performing mothering undertakes, which hinders their economic security, safety, and well-being. And we specifically use mothering rather than the mother because in a context like ours, so many other people are caring for children. It's not only the biological mother. And that is a decolonial way of thinking through what care looks like and dismantling these assumptions that it is a biological mother who's got direct control over how a child is cared for. But we also unpack, importantly, you use these infographics to really unpack what the historical legacies are of unpaid care in this country, how it affects women, what the infrastructural barriers are, where there's infrastructure failures. And we also show that it's seasonal. So this is the nuance we were able to get from the photo voice methodology. So back to school is a real struggle for low-income mothers, materially and mentally. Adverts and letters from schools tend to assume that the mother is the sole person responsible. So the media is targeted towards mothers, and the school letters are targeted towards mothers without explicitly saying so, to get the child school ready, using language that is gendered. We even saw at the beginning of the year diaries for moms. They were called mom diaries, and it had schedules of how to be on top of everything, and recipes to look to cook, so that you are meeting these standards of what good mothering looks like. And we're really trying to dismantle some of that, calling these things out. So then it brings me to our approach. Liz said I'm a decolonial feminist scholar, and I cannot emphasize our approach enough in this project. It's the how is fundamentally the core of this work that we do. We center low-income mums as experts of their lived reality, producing valid knowledge. That's when we're looking for evidence-based or evidence-informed. This is the evidence. It doesn't show a p-value, it doesn't show statistical significance, but it is their lived reality, because often only relying on quantitative aggregates in a country like ours with extreme inequality then designs solutions for an aggregate which we don't really have. And then those on the levels of extreme poverty don't get to benefit from these offerings. It's deeply collaborative, and I'll speak to this in a few slides. We partnered with, in the scaling project, with 11 low-income mums and 11 fathers, with government, with civil society partners, and a team of transdisciplinary academics. We partner with our partners from the moment of conceptualizing the project. So together, we write the grant, we have a shared understanding of what the project entails, and we speak regularly. It centers an ethics of care. So we thought about, if we want the mums to be, we see the mums as experts, we need to pay them a daily living wage for the days that they work with us. We offered on-site childcare, so that childcare isn't a barrier for them, sharing with us their lived realities. We offered private transport because public transport systems fail mums. And we offered healing sessions because while we initially intended to offer social support in terms of social workers, the mums said it doesn't help them. They don't feel supported. They speak and they speak and they get sent somewhere else. And, it just wasn't something that was helping them, because they had to go to the same communities. And we started healing sessions for them to be able to regulate their breathing and work with their own central nervous system. And then it's creative because we're using photo voice, we use iterative feedback loops, which I'll speak to, and it's feminine-led. So we focus on compassion, inclusivity, and trust as antidotes to oppression and extractivism. So very briefly, this is our iterative feedback model. Between every data collection session, we work with our stakeholders. So if we collect data on a Monday, Tuesday, Wednesday, we speak to our stakeholders, for example, on the Friday, while it's still fresh in our in the way that we felt the mums' lived reality. And this allowed our stakeholders to be able to take the data as it was emerging into their spaces of influence, shift their thinking, and start to engage in improvements in the spaces that they had some influence over. So the photo voice, we co-created prompts with the mums and later the dads. The mums' prompts were the 4 prompts that the mums wanted to take photographs of were things that influence how they mother and experience the motherload, the things that are difficult to coexist with mothering, what is missing in care services and programs, and other services that mothers need, and what does a community that uplifts mothers and cares for low-income mothers look like. So I'm going to take you through one photo in each theme, but also raise what the conversations led to. So in this example, the mum started speaking about the challenges of safety and time, sometimes not being able to take her child to school because they had to leave much earlier to get to their employment, or it meant foregoing employment to take a child to school. So they spoke about how jobs for low-income mothers do not have flexible hours to be able to care for children. Some mothers felt forced to leave their children on their own an hour before the creche opened. Otherwise, they wouldn't have any money for food for the next day or for nappies for the next day. And creches were costly, so they spoke a lot about the cost. At 450 Rand a month, a mother may have then been able to afford a creche where they knew their child was neglected. For example, the same bottle was being put into multiple children's mouths, and also there was nobody really watching the children at all the time. And even though these didn't meet the standards, they also didn't want the creche to close because they needed the service. But the better creches at 850 Rand a month made mothers feel less anxious, feeling that their children were more safe. But the child support grant is only 530 Rand, and so this was often unaffordable. Those who chose to care for their children themselves then could not find employment opportunities, and mums were always stressed about gang violence in the area and the kidnapping of their children. So it was really a tension that they had to hold. The second theme, this is a photo that a mum took of a rough road. I've already spoken about many of the challenges that these photographs have elicited both in the pilot and in the scaling project that set mothers back. So I'm going to focus only on the section that speaks to the what's in bold. These facilities often play a role in bringing a person down. Low-income moms are often treated with very little dignity in these services, as though their time and mental capacity do not matter. They get sent from pillar to post, as I mentioned. They are dismissed. When they report being raped, for example, they're made to feel as though it was their own fault. In spaces where they are being engaged as mothers, like creches or clinics, they are made to feel inadequate, yet they're doing their best that they can, and the systems fail them over and over again. So these photos also led to conversations about how mothers were surveilled, every move of theirs being watched and judged against standards of good mothering. And these situations had detrimental consequences on their mental health. A photograph on theme 3 again speaks to a lot of the lack of integration between services and design of jobs versus, health services and daycares. But in addition to that, it speaks to how care work remains a private issue. So the mum speaks about having to navigate this unpaid care work on her own, as though it's her sole responsibility to solve her own challenges. This also led to real conversations on the real struggle of hunger. Often mums forwent food for themselves so that their children could eat. Also, how the lack of access to affordable Wi-Fi was a problem, and it could make their lives so much easier, both for social support and for accessing resources. The constant mention of time poverty in how they had to navigate multiple systems, the lack of safe spaces for children to play or for mothers to just take a break, and the lack of safe houses for mothers to escape to with their children in instances of abuse. And then the fourth theme, this mum took a photo of an empty cigarette box to show that how empty she felt inside. And this speaks to the lack of community support. It led to conversations again, about mums being felt as though they're solely responsible for raising a thriving child, not the father, not the community, and not the role of the state. And any sense of community care in these contexts have been eroded by poverty. So these mums are exploited by loan sharks if they need to borrow a bit of money because they've got nobody else to turn to. And even asking a neighbor for salt becomes a shameful activity because the whole community will be saying that this mother can't even afford salt. She is so poor. And also even spaza store owners who charge mothers for accessing their social support grant of like 50 Rand, which then leaves them with so much less. So improving community support was desperately needed, and some mums were hopeful that this could happen. So from all the photographs that the mums took, they then engaged in collective analyses through this social ecological systems way of thinking through how to solve and address their needs, both, all at the individual level of what they had control over, the household, community, and broader institutional levels, which then brought us to them putting together a call to action. So this call to action is part of the exhibition where they get to communicate their most urgent needs to diverse sets of stakeholders. And of all the issues that the mums confronted, the three they wanted addressed was employment opportunities that recognize and adapt to caregiving needs, mum hubs, which was sort of like a central hub where they could access various offerings on both equipping themselves, but also addressing their mental health concerns and providing support in various ways. And then safe and caring communities for mothers and children. The safety of communities was really made mothering challenging, and the lack of support for mums and children. I've highlighted in yellow three that speak directly to ECDs, and that is establish affordable and quality ECD centers and creches close to where mothers work. So the proximity of where mothers worked and ECDs was really key so that they didn't have to spend large amounts of time traveling, but also that in emergencies they could get to their children quickly. Expanded employment opportunities for mothers in childcare centers, so in ECD centers that could employ mums, in schools, in libraries, and monitor and strengthen the quality of ECD centers in terms of safety standards and competent staff. So the rest in blue, and in fact all, speaks to, I'm not going to go through them, but speaks to the ecosystem of what is needed for the mother and the child to thrive. And you'll have access to the slide so you can go through it in more detail. So we replicated this entire process with fathers, and I'm not going to take you through all their photos, but I wanted to say that we are focusing specifically on their perspectives of care to get a more complex understanding of the motherload, and then also how do fathers' perspectives on care help develop responses to shift gender norms and reduce the motherload. So the four fathers' prompts were to develop their understanding of visible and invisible care, causes of the motherload, the barriers to engaging in care work, and the role of men in reducing the motherload. So they took photographs similarly and did collective analysis, but I just wanted to speak to one photograph, and this was really speaking to the invisible care and showing how men, that firstly the care is invisible, but also men know. They said she is broken like this tile, but even though we know she's broken, she has this duty to care. So we walk over this broken tile as though we're walking over this mother over and over again. And it was just so powerful to show that, like, women are just kept accountable for unpaid care work, even though men can see that she's exhausted and about to break. In August, I said we brought the mothers and fathers together, and this was really incredible. In fact, if we had more time, the moms and dads wanted more sessions to share what their experiences were on unpaid care work. The dads sort of said to the moms, "We see you, we hear you." They felt very motivated to be allies, and that was incredible for the project. And then this was the launch of the exhibition that is currently on. I'm going to share, I think I've got maybe almost no time left, but very quickly, I'm not going to go through the details. This project's been incredibly impactful from the moms, and from the moms themselves. They said the motherloads become visible. Men's behaviors have changed once they've started speaking to their partners. There's more harmony in the house. There's less stress. And the concept has given them a language to use, and knowing that it's not only an individual struggle, it's actually out there that all mums are struggling with. We've had impact with Flourish at the programmatic level. We've included a module on the Motherload into their work, which has reached thousands of mums. It's become part of the language they're using. It's shifted their models in which they work through and think through their program. We've had impact at the government level around shifting in thinking of unpaid care work, looking at care infrastructure investment, this work informing a pilot project, and yeah, that's been incredible. And then just the contribution of the Motherload lens in the ECD space. There's been several contributions. I think just thinking through transformative and integrative policy rooted in lived reality, thinking about a holistic ecosystem that values and supports caregivers alongside children. It shows sort of the needs at different, where investment is needed. And it offers evidence, as I mentioned, and it's a rigorous collaborative method that could be used in your own spaces. Lastly, just a few questions to ponder about. How do we bring mothers' employment and ECDs into greater alignment? How do we engage low-income mothers with more dignity in services? How do we reduce the motherload and redistribute it to fathers, communities, and the state? And how do we ensure that lived reality as a valid form of knowledge is informing our decisions, practices, and policies? Thank you. And that's the QR code to our website.
Fantastic. We'll leave it there for another minute for folks to snap the QR code. Thank you so much, Amita. Phew. Yes, Nick. For me, you said a lot, and we could go on for hours because it's quite dense, and you try to make it something that is so broad, and it evokes a lot of emotion, very concise. And I think the point or the broader take-home message is that these issues, our ways of addressing the different challenges are too siloed, and we need to be more intentional about the interconnectedness of different aspects. Like, human beings are complex. We can't just address one area without thinking about the ripple effect or the impact on another area. And I think a provocation is also for us in the ECD sector and the ecosystem on how we see childcare and early childhood development, and how we have traditionally perhaps approached it as a child-centered issue and not necessarily seeing the bigger picture of how the caregivers and the community at large and bigger structural issues also feed into this thing, into what we are trying to change for children. So I liked how we are broadening the conversation on early childhood and caregiving, not to necessarily to be like we need to take care of children, but we need to take care of the family unit as a whole to be able to address some of these very complex issues that obviously we can solve overnight. So thank you for that. From the comments from in the chat, I think the methodology and the entire project is quite attractive and refreshing. It's a breath of fresh air and a breakaway from traditional sort of thinking. So we're going to take a couple of questions and see where we go. I see a couple of questions in the chat, in the Q&A, and I wonder if we could unmute Dominique.
Hi.
Dominique, speak. Yes, go
Can
ahead.
you? Thanks. Thank you. This was amazing, and it's lovely to see the transformative approach you've taken. I'm interested in just how you went about the advocacy side of things. I mean, you spoke quite a lot about, well, at the end, about policy shifts and shifts in how employers go about the economic side of things. So I'd just be interested in how that worked in your research.
Yeah, so if I understand the question correctly, we were able to work very closely with Flourish, who was is our women's community partner, and Flourish used the insights already from the pilot to shift their social franchise model. One example was just in terms of so it hasn't necessarily created very broad economic opportunities, but it's informed. So in Flourish, it's informed their social franchise model, and they've shifted that to remove a fee, which allowed moms from 11,000 moms to 18,000 moms to join their antenatal program. It also then means that more moms can move on, for example, to become Flourish hosts and Flourish coaches along the way if there is their pipeline to get further involved in Flourish. So that was one of the ways in which the advocacy work helped. And then in terms of the government's initiatives on thinking about designing jobs, and because of our examples of how jobs were there, but they weren't accessible to women with caregiving demands, to think through how to then create employment opportunities that do center care, that recognizes that women are not being able to access economic opportunities. So it's shifted thinking in the government spaces, but we haven't got to a point where, for example, we can say this initiative's been rolled out and it's created X number of employment opportunities for women because it centers care.
Okay, amazing. Thank you.
And I think if I can add my 2 cents to that, Dominique, it gives us an opportunity, especially for those stakeholders working in the policy regulation spaces, to obviously think about the demands we make of government and how we can also weave in some of these real lived realities and important concerns into our work in shifting policy and change in that area, I guess. So we're going to take a question from Chantel Witten, but I think if I'm correct in saying, Amita, that the exhibition is not online, it's physically available for ethical reasons. Maybe you can speak to that, yeah.
So it's currently a physical exhibition, and we are working on a online book of all the photos with their captions and some information around the exhibition, and that we're hoping should be out in the next 2 or 3 months.
All right. So Chantal Witten, if you can ask your question, please let's be direct so that we can give other folks opportunity to engage. Thank you.
Thank you, Liz. Thank you, Amita, for a great presentation. So my question is a little bit provocative. I was asking the question about protecting mothering. I am working in the ECD space now. I completely get that there are other caregivers and circles of care around children, but I see more and more that the mothering role seems to be outsourced. So, for example, breastfeeding, we saw the outsourcing towards alternative feeds. Play dates are being outsourced. I was wondering, in this body of work that is now being generated, what are the opportunities and what should we be doing to be protecting mothers who want to mother, who should be enabled to mother?
Thanks, Chantal. And
Thanks.
I don't think it's provocative. All the mums want to do mother. Like all our mums gain so much joy out of mothering. It's their circumstances that often made them have to choose between a job and mothering, between this and that. And so it pointed to the infrastructures that weren't set up and the way in which particularly employment is designed. So it's designed again on male bodies that the idea of like employment is designed on male bodies that do not have a reproductive body that needs to pause to have children to be. And then because of the care falling solely with the mothers in many instances, there just aren't the supports. So mums are feeling completely stretched thin and doing everything that they can to pretty much just hold it together. And so on one day, they might be able to mother the way they want to, because that day maybe they'd earned some money the day before. The next day, they might not, and they'd have to then have it, they've, you know, it's like you've got a set of decisions to make in front of you. Do I mother today, but then I don't have food for my child? So today, then I'm going to earn, but then I can't mother. So it's a constant sort of load that they've got to work through. And it's never because they want to give up the mothering. It's because the times of employment doesn't work with the times of caring. And without any form of money, they can't survive. So I think there's the mums just, there was really a wanting to. I don't think there was we never heard once wanting to outsource in favor of. It was always a dire decision to make a choice between difficult decisions because the infrastructure wasn't set up to understand that jobs need to accommodate, or not even accommodate, jobs need to be designed around caregiving.
Well, this is so powerful. We're going to take another question from Vuyokazi Moyeli. Sorry if I am saying your name wrong. But before Vuyo comes in, Magali is really hitting the hammer on the nail here, and that this is really powerful and inspiring presentation, right? It's a wake-up call on you know, getting us to check our unconscious biases and negative stereotypes on low-income mothers, comparing their parenting with what we think good parenting looks like. So that kind of boxing in of people without nuanced understanding. So this presentation is well received and welcome, a breath of fresh air. I'll give Vuyo the opportunity to ask his or her question. Thank you.
Okay, thank you so much for this presentation. It's really it's really insightful and very interesting. I think earlier on the formative stages, you touched on, you know, the excuse me, the gendered perspective on normalizing care, you know, as a responsibility for women. And yeah, I found your participation of, you know, fathers very interesting, and I'm curious as to what their, you know, participation in this project brought about in terms of like actionables, insights, their perspectives, and proposed solutions in how actually they can sort of like reduce the mother load, the unpaid caregiving. Also, I'm asking this question because I know that in as much as, you know, there's this gendered perspective on caregiving, especially, you know, in regards to children, there's also this normalized, very normative, gendered perspective that men ought to just provide financially. So I'm really interested in, understanding that as a result of their participation in this project, what were their, newfound insights, perspectives, and, proposed solutions and actionables. Thank you.
Thank you for that. Yeah, I wish I had so much time to speak through to the father's work. But it was really interesting because the fathers came through the School of Hard Knocks, and they'd gone through this short course called Next Gen Men. So they thought they were progressive fathers and were wanting to, were doing a lot. We started with the 24-hour care exercise, where we asked them what care needs to happen in those 24 hours, and they came up with the things that they could only visibly see. And then then Yanga, who worked with them, forced them to think, okay, before a child has to have breakfast, what has to happen? How did you get the food in the house? Who had to think about what food was age appropriate for that child to eat? Who had to think about having clothes for the child? Who had to know that the seasons were changing so that you had the right clothes? Who had to think about that the child is outgrowing certain clothes? And suddenly there were all these invisible aspects to care that they'd never seen before. But also what they had to do was they had to label an M for if the mother did it, or F for if the father did it. And then suddenly they visibly saw that actually they don't do so much, right? So I think that was a key exercise in starting this process. And then when they got to speak to their photographs, I think it really became a process where they started thinking about and seeing the infrastructure and the ecosystem of care and what needs to happen to support care. So there are 3 calls to action, and I'm happy to include it in the set of slides that Liz distributes. Is they wanted to then have gender equal care systems. And they listed a number of things that contributed towards gender equal care systems. I probably won't have enough time to speak to them. And they wanted social and community programs that promote men's involvement in care. And they wanted to address absent fathers, including, which they added, including present but absent fathers. So fathers that just sit in the house. And I'll give you 2 examples. One, dad took a photo of a washing machine, and we assume that it's to say, oh, the woman does the washing. But it moved from that sort of physical act of the washing machine to saying, he calculated how many years they'd been married, how many days that had equated to, and said how that washing machine spins without a break in a cycle. That's his wife and the mother of their child spinning over and over again, whether she's tired or not. And so they started to understand sort of the mental load, the emotional load, the different nuances to the complexity of care. And they started asking for things to shift. So he said, I can't sit. One father said, I can no longer, even if I come home, I used to say, oh, I worked, so now my job is done in my head. And if I saw a pair of socks on the floor, I knew I didn't have to pick it up because I've done my job, I worked. And that shifted to say, now I see those socks and I feel uncomfortable because I know that if my wife's been at home working all day, it is work. And so they're seeing unpaid labor as labor and their role in it. But they've come up with, and it's too many to talk about, they've come up with a number of interesting ways that men can be more involved, and recognizing that, for example, sometimes playing and being there emotionally is more important than bringing in finances only.
Yeah. Unfortunately, the time will not allow us to go on. Can I commit you to coming back and giving us the male perspective? Because I feel like we are leaving it at a very hectic cliffhanger. This was not meant to be like fathers are not doing anything. There's so many amazing contributions from the male folks. In my household growing up, my dad was the chef, my mom was a mechanic. So I've experienced how male figures also show up in care work and supporting families and children to thrive. So I think you need to come back. I am going to follow up on that. But thank you so much for this powerful presentation of a really important piece of work, like it's solid, and we would love to hear more in 2026 if we can we can do it again. Thank you, Amita.
Thanks so much, Liz, and thanks for having me.
It's a pleasure. Folks, unfortunately, this is the last webinar in the series for 2025. Thank you for everyone who has joined every single one of our webinars. For the new folks, thank you for joining today, and we hope to see you in 2026. I must thank our technical team for all their wonderful support, our partners in Data Drive 2030 and RESEP for such passionate research advocacy on children and families, and also, last but not least, all of you for your passion and your, showing up every day trying to make the lives of children and communities work for the better. Thank you, and we hope to see you in 2026 with more interesting issues to unpack, great solutions, and, having moved the needle on some of the demands that we have heard today and in our various different individual work. So with that, I thank you and I bid you farewell. If you're traveling for the holidays, keep safe and join us again in 2026. Have a great afternoon.